Hi, my name is Dr. Mirrafati from Mira Aesthetics again, and I'm going through this educational series about breast implant, breast augmentation. So the golden question is, what size implant should I get? What size implant should one person get? That's a question I get all the time. When I do a lot of virtual, they ask me, what size should I get? Well, in a nutshell, is patient dependent. And I talked about it in other videos, and I'm talking about it specifically in this video because our topic is what size should I get? In my clinic at Mira Aesthetic, patient comes in and I give them a guideline. Having done over 8,000 augmentation, I tell them, I think in my opinion, anything from 300 to 400 is good, but you get to choose it. You decide. You actually come in, we put the implant inside of a bra we give you. You put your shirt over it and you look at the profile and you look at the projection on sidewise to this projection in the buttocks and the shape of whole body and proportion. Generally, people come in and say, I want to be D, I want to be C, don't want to be D, I want to be extra D, whatever, double D, whatever you want to call it. It's all about proportion. It's all about proportion. Whatever you want to call it, D's, X, F, M, whatever that nomenclature is, doesn't matter. Does this fit my body profile? And that would be your size. And the best way to do this is to actually try out the sizes and put it in and look at it. That's the best way. But however, there are scientific way of doing this as well, where you can actually measure the diameter of the chest and go on the book where it shows the diameter of the implant. You say, okay, this is the diameter you have that translate into this size implant because this shows what the diameter is. But you can go up and above and beyond and upper, maybe 50 cc higher or 50 cc lower from that scientific measurement. But in a nutshell, if you want to know about the sizes, anything from 300 to 400, you are in a C range. So 300 is a low C. Where it goes to 400, you're about a D or a full C. Anything in 400 to 500, you're in a D range. So you use 400, a small D, and then when you go up to 500, you're in a full D or possibly the beginning of a double D. And anything above the 500, you are going to be in a double D range. But that doesn't mean double D is bad or that doesn't mean C is good. It just means whatever generally that means size of the cup size of the implant, right? But it has to be proportioned to your body. I keep telling you, so all my videos, it's the proportion that matters, not the number. Number doesn't mean anything. It's just a proportion of, does this fit my body? Does this make me more curvaceous? Does this give me more projection? And there's also different implant that can have the same diameter but higher projection. But I guess whoever doctor you decide to go, they should bring out a different implant and explain to you from moderate to high, extra high, boost implant. There are different implants out there, then that can be explained to you. However, having said that, the most common size implant is basically anywhere from 350 to 420. That's what it is. I've done over 8,000 augmentation. Generally, I would say if I was one implant that I cannot go wrong with is 400. It's right in the middle. It's not too little, it's not too big, and majority of patients are happy about it. But having said that, I don't want you to come in here and say, you said 400, so I'm going to do 400. It might not look good on you. You might have to go bigger or possibly a smaller. And that's where we determine by measuring you and doing it scientifically, as well as by doing visual check. Visual check is the best thing to go. So what size implant should I put in is all patient dependent. Average anyway from 350 to 425, and the median about 400. That's what I would say the safe number is. Stay well.